So I'm reviewing a case of a turf toe and a gentleman that was picking up some wood, young man, and he stepped in a kind of a little rut, and he jammed his toe, sprained it, developed a little turf toe, and we're going to take a close-up look. Right here where I'm moving the arrow, you can see how the joint is swollen in here, jammed up. The joint space is very tight. Here's just another look of the same joint, and you can see there's been some squaring off, and that's occurred over time. That's not overnight, but the soft tissue swelling certainly. And when you get this decreased joint space and joint adaptation, that is indicative of some longer-term changes that have occurred. So we're not only dealing with the acute injury of stepping in the hole, but the longer term, and we're going to see how this electromagnetic treatment works out. Okay, so we have a case of turf toe. We're going to take the splint off. I just want to do a pre. You can go ahead and take it off, and we're going to look at dorsiflexion, plantar flexion, and go ahead and extend your foot out, and let's see what we got here. So I am calling that for you about 15 degrees, maybe. Pretty boggy to swollen around it. A little more plantar flexion, plantar grade. I'm calling that maybe just short of 20 on the plantar grade. So you're definitely hooked up more on the dorsal. That's the pre. I have taken it through the range of motion a couple times just to kind of warm it up a little bit, but a lot of flexion now. We did not have that much flexion last time. No way. End range, where it's still getting jammed up a little bit, and I do see the skin lines at end range, at that end range block, and we see the skin lines right here. See them kind of ripple a little bit. It's a little modeled from the vascular response, but now we can see that puckering, which we didn't have before. So at this level, I'd say you got about 5 degrees more. Maybe you're at almost 20. But end range jamming pain, what would you characterize the end range jamming? And now we're seeing the flexion lines even better.
Probably a 5 or 6 out of 10, like a dull pain.
And you were at about an 8, maybe?
Yeah, 7 or 8 sharp.
So
pain.
about
Yeah.
15 to 20%. That's not bad for treatment 1.